Now posterior compartment of the leg or back of the leg. It is also known as calf and it corresponds to the front of the forearm. It is bulkiest of the three compartments of the leg. Now superficial fascia of the back of the leg contains two superficial veins, that are the great and short saphenous veins, and 7 cutaneous nerves. The cutaneous nerves are saphenous nerve. Saphenous nerve pierces the deep fascia on the medial side of the knee and accompanies the great saphenous vein. It supplies the skin on the medial side of the knee, leg and medial border of the foot up to the ball of the big toe. Another is the posterior division of the medial cutaneous nerve of thigh. It pierces the deep fascia a little above the knee. It supplies the skin of the uppermost part of the medial 1/3 of the calf. Another is the posterior cutaneous nerve of the thigh. It pierces the deep fascia in the middle of the popliteal fossa and descends with the small saphenous vein to supply the skin of the upper half of the intermediate area of the calf. Another nerve is the sural nerve. It is a branch of the tibial nerve in the popliteal fossa. It pierces the deep fascia in the middle of the leg and runs along the short saphenous vein. It supplies the skin of the lower lateral part of the back of the leg, lateral part of the lateral border and adjoining part of the dorsum of the foot and lateral side of the little. Another is the lateral cutaneous nerve of the calf. It is a branch of the common peroneal nerve in the popliteal fossa. It pierces the deep fascia over the lateral head of the gastrocnemius and supplies the skin of the upper 2/3 of the lateral area of the leg. Another is the sural communicating nerve. Sural communicating nerve is a branch of the common peroneal nerve. It supplies the skin of the posterior medial part of the lateral area of the calf. Now flexor retinaculum. Flexor retinaculum is a thick, broad band of deep fascia. It is 2.5 centimeters broad on the medial side of the angle, behind and below to the medial malleolus. It holds the long tendons, nerves and vessels in position. Now attachments. Anteriorly or above it is attached to the posterior border and tip of the medial malleolus, and posteriorly and below it is attached to the medial process of the calcaneal tuberosity. Structures which pass deep to the flexor retinaculum are from medial to lateral side. There is tibialis posterior, then flexor digitorum longus, posterior tibial artery, posterior tibial nerve, flexor hallucis longus tendon. Then we have you can remember it by the mnemonic. The doctors are not here. The means tibialis posterior, doctors means flexor digitorum longus, then artery, then nerve, then hallucis longus tendon. Now the posterior compartment, its boundaries are anteriorly it is bounded by the posterior surface of the tibia and the fibula interosseous membrane and posterior intermuscular septum, and posteriorly lies the deep fascia of the leg extending from the medial border of the tibia to the posterior intermuscular septum. The posterior compartment of the leg is subdivided by two strong transverse facial septa, superficial transverse facial septa, and deep transverse facial septa into three compartments: superficial, middle, and deep. The superficial compartment contains the gastrocnemius muscle, soleus muscle, and plantaris. Middle compartment contains the flexor digitorum longus, flexor hallucis longus, and posterior tibial nerves and vessels. And the deep compartment contains the tibialis posterior muscle. Now we will have an idea about some muscles of the posterior compartment. We have gastrocnemius. It is the largest and superficial muscle of the posterior compartment. It consists of two heads, medial head and lateral head. Medial head arises by a broad flat tendon from the posterior superior aspect of medial condyle of femur, and small lateral head arises by a broad flat tendon from the lateral surface of lateral condyle of the femur. The fleshy bellies of the two heads descend and unite at the middle of the leg to form broad thin aponeurotic tendon, which unites with the tendon of the soleus to form a long thick tendon, the tendocalcaneus or Achilles tendon, which is inserted into the middle of the posterior surface of calcaneum. Both heads of the gastrocnemius are supplied by the tibial nerve in the popliteal fossa. Now, actions of the gastrocnemius: is the chief plantar flexor of the foot, and it is also a flexor of the knee. It provides rapid movement of the foot during running and jumping. Now, another muscle is the soleus. It is a multipinnate muscle lying deep to the gastrocnemius. It resembles the shape of the fish, that is why it is known as soleus. It arises from the back end of the head and posterior surface of the upper 1/4 of the shaft of fibula, and also from the soleal line and middle 1/3 of medial border of tibia, and also from the tendinous arch between the tibia and the fibula. The muscle fibers slope downwards to form a massive belly, which gives rise to a tendon. The tendon of soleal fuses with that of the gastrocnemius to form a tendocalcaneus. Now, it is supplied by two branches of the tibial nerve. The first branch supplies the muscle in the popliteal fossa from its superficial surface. The second branch supplies the muscle in the posterior compartment of the leg from its deep surface. Now, actions: it is a plantar flexor of the foot at the ankle and steadies the leg on the foot during standing. It is considered as the workhorse of the plantar flexion. It is slow acting but more powerful. Now, gastrocnemius acts as a top gear and soleus acts as a bottom gear during walking. The two heads of the gastrocnemius and soleus together form the triceps surae muscle. It is known as triceps surae muscle. Two heads of the gastrocnemius with the soleus. Sometimes a small sesamoid bone is found in the tendon of origin of lateral head of gastrocnemius, that is known as fibula. Now, plantaris, it is a small muscle which is with a short belly and long slender tendon. It arises from the lower 1/3 of the lateral supracondylar line and adjoining part of the oblique popliteal ligament. Its tendon blends with the medial margin of the tendon-Achilles and is inserted into the middle 1/3 of posterior surface of the calcaneum, medial to the attachment of tendocalcaneus. Now, plantaris is a vestigial muscle in human beings and is absent in 5 to 10% of people. It is the muscle which is used for grafting. That is the reconstructive surgery of the tendons of the hand. Now, deep muscle, popliteus muscle. It is a thin, flat, triangular muscle which forms the inferior part of the floor of the popliteal fossa. It arises from the deep anterior part of the groove, popliteal groove, on the lateral surface of the lateral condyle of the femur, arcuate popliteal ligament, and outer margin of the lateral meniscus. The tendon passes downwards and medially and flares out to form the fleshy part and is inserted into the medial two-third of triangular area above the soleal line on the posterior surface of tibia and also popliteal fascia. The popliteus is supplied by a branch of the tibial nerve. Now it unlocks the locked knee by rotating the femur laterally during initial stages of flexion of the knee. You should remember that the popliteus is the unlocker of the knee. It pulls the lateral meniscus backwards and prevents it from being trapped and crushed between the condyles of the femur and tibia, and it flexes the knee during couching. Now, posterior tibial artery, it is the larger of the two terminal branches of the popliteal artery. Its branches not only supply the posterior compartment but also the lateral compartment of the leg and sole of the foot. It begins at the lower border of the popliteus between the tibia and fibula deep to the gastrocnemius and enters the back of leg by passing deep to the tendinous arch of the soleus. In the reg, it runs downwards and slightly medially to reach the posterior medial side of the ankle, midway between the medial malleolus and medial tubercle of the calcaneum. It terminates deep to the flexor retinaculum by dividing into lateral plantar artery and smaller medial plantar artery. Medial plantar artery and lateral plantar artery. Now, throughout its course, it is accompanied by the tibial nerve, which crosses the artery from the medial to the lateral side. Now, it gives fibular artery or peroneal artery. It is the largest and most important branch of the posterior tibial artery. It arises 2.5 centimeters distal to the inferior border of the popliteus. The posterior tibial artery gives the muscular branches to the muscles of the posterior compartment. It also gives the nutrient artery to tibia, which is the largest nutrient artery in the body. It gives circumflex fibular artery. It encircles the lateral side of the neck of the fibula, and it gives the communicating branches. It also the medial malleolar branch, also the calcaneal branches which pierce the flexor retinaculum and supply the soft tissues of the heel, and terminal branches are the medial and lateral plantar arteries. Now, peroneal artery, it is the largest and most important branch of the posterior tibial artery. It provides blood supply to the posterior and lateral compartment of the leg. It arises 2.5 centimeters below the lower border of popliteus. It runs obliquely towards the fibula and then descends along the medial crest of fibula in the fibrous canal between tibialis posterior and flexor hallucis longus. It passes behind the inferior tibiofibular and ankle joints and ends on the lateral surface of calcaneus and terminates by giving the lateral calcaneal arteries. Now, branches, muscular branches to the posterior and lateral compartment of leg, nutrient artery to the fibula. It gives communicating branch which joins with a similar branch of posterior tibial artery, and perforating branches which are large and pierce the interosseous membrane about 5 centimeters above the ankle. Now, lateral calcaneal arteries artery is the terminal branch which takes part in the formation of lateral malleolar plexus. Now we have one nerve of the posterior compartment, that is the tibial nerve. It arises on the back of the thigh at the junction of the upper 2/3 and lower 1/3 and enters the popliteal fossa. From the popliteal fossa it enters into the posterior compartment of the leg by passing deep to tendinous arch of origin of soleus along with the posterior tibial vessels. Its course and relations in the leg are similar to that of the posterior tibial artery. In the leg, the nerve is lateral to the artery at first, and then it crosses the posterior to the artery from medial to lateral and then runs along the lateral side of the artery. It terminates deep to the flexor retinaculum by dividing into medial and lateral plantar nerves. It gives muscular branch to popliteus, tibialis posterior, flexor digitorum longus, flexor hallucis longus, and soleus. It gives cutaneous branches, that is the medial calcaneal branch which pierces the flexor retinaculum and supply the skin on the back of lower surface of heel, and it also gives articular branches to the ankle joint. Now the relationships of the tibial nerve is similar to the posterior tibial artery.